Hello and welcome to our session today. Today we are looking at mastering breastfeeding techniques, and I'm Thomas. I'll be the facilitator of this course. This course is a CPD approved, and if you log into the World Continuing Education Alliance, you'll be able to interact with these tutorials. You'll be awarded CPD points thereafter. So the objective for this small tutorial is that by the end of this session, you should be able to demonstrate proper breastfeeding positions, that is cradle, cross-cradle, football, side lying, and laid back. There are 5 positions. You should be able to also recognize and manage common breastfeeding complications, that is including engorgement, sore nipples, and plugged ducts. Lastly, you should be able to deliver an individualized, culturally sensitive breastfeeding support across a hospital and also in a community setting. Let's begin by defining what breastfeeding is, and several studies, several scholars agree that breastfeeding is the normal way of providing young infants with nutrients they need for healthy growth and also development. World Health Organization further emphasizes that exclusive breastfeeding should be for the first 6 months of life, meaning that the infant here only receives breast milk without any additional food, no drink, not even water, unless it is medically indicated, like in the case of dehydration, diarrhea, and any other conditions. So after 6 months, complementary food uh, should be introduced, and this should be done while continuing breastfeeding. Breastfeeding can happen up to 2 years of age or even beyond. So for the first month of life, you're supposed to be breastfeeding on demand, and you should be able to breastfeed the baby for at least 8 to 12 times daily. Remember, breast milk is nature's perfect food for babies. It contains carbohydrates, mainly lactose. This is for energy and healthy gut bacteria. It also has proteins, like for the case of whey and the casein. These are immune protective components, also including lactoferrin and immunoglobulin A. It also has fats which do support brain, eye, and nervous system development. We also have vitamins, a DEC and B complex. This is vitamin A, D, E, and K. And these are vital for growth, immunity, and energy. The breast milk also provides minerals such as calcium, iron, zinc, and iodine, which are all essential for bones, blood, and brain development. Lastly, breast milk also contains antibodies, enzymes, hormones, and oligosaccharides, which normally protect us against infection and support digestion. In summary, we do say that breast milk provides complete nutrition and immune protection that is custom made for the baby's growth and health. Even as you breastfeed, you need to be aware of the cues to feed. So you need to watch for feeding cues like rooting and sucking motions. And remember that it is the hormone oxytocin that is going to trigger milk letdown. Hormone oxytocin is also commonly referred to as the love hormone. When you breastfeed, you bond with the baby, and that's why it is indicated in such cases. So we have several breastfeeding position, starting with the cradle position. Cradle position, this is classic cradle, but you have to know that this will not be ideal in post-cesarean. So here you find that the mother will sit in a comfortable position and cradles the infant's head on her forearm, right? And the infant's back along the inner thigh, in the inner arm and palm. If the mother had a cesarean birth, this position will put too much pressure on the abdominal incision. That's why Rogan and Wambach note that this will not be ideal for post-cesarean mother. The second position is the cross-caddle position. Cross-caddle position is great for learning with better neck support. So during the early weeks of breastfeeding, many moms normally find Crosscaddle position, very comfortable. This has been noted by Spencer 2021. The infant lies on a pillow across the front of the mom's body. So using the opposite hand from the breast being used, mom places a hand behind the infant's ears and neck with the thumb and index finger behind each ear. The infant's neck rests on the web between the mom's thumb, index finger, and the palm. The mom supports the infant's back with the arm, which is in a line on the pillow. This is according to American Academy of Pediatrics. The third technique is the clutch position or the football position. Remember, clutch is normally ideal for large-breasted women, cesarean mothers, or those who are feeding twins. So it's commonly selected by those kind of mothers, and this has been noted by the US Office on Human Health. This position is also useful for feeding twins and infants who are small or immature. The infant is held by the mom's side with the mom's elbow bent, supporting the infant's back with the arm and the infant's head with the hand. Pillows can help bring the infants up to the nipple height. The fourth position is sideline position. So the sideline is perfect for night feeds and recovery. So a mom can choose this side position at night or during recovery from a cesarean section. The mom lies on one side with the stomach facing the infant's stomach and the infant's head near the breast. The infant's ear, shoulder, and hip should be in line with the hips flexed. This has been noted by American Academy of Pediatric Nurses. The infant's body can be cradled in the mother's arm with the back against the mom's forearm. The last position is the laid back position. So here the mom lies on the back with the head and shoulders well supported, allowing the infant's whole front body to touch the mom's body. The infant's cheek rests somewhere near the mom's bare breast. The infant uses natural instincts to feed. The mom helps the infant as much as desired. This method normally encourages the mother and the infant to relax and just enjoy each other. So remember that each mother should find what works best for her comfort and the baby's large. So we have those 5 breastfeeding position. And just to make sure that we remind them and we still at least stick in our head, we have we have a song here. This song, the lyrics, I got these lyrics and I was inspired by the Twinkle Twinkle Little Star. This Twinkle Twinkle Little Star was written by Jane Taylor, an English poet in 1806. I don't know whether your grandparent was there by then, but anyway, it has helped us get the song. So we say the twinkle twinkle little star. So we have the cradle hold is snug and sweet. Crosscaddle helps you latch complete. Football's great for healing pain. Sideline works when lying plain. Laid back gives you rest and ease. Feeding baby with such peace. All right, we can practice this song later so that we maybe master it. But for now, allow me to look at the breast care for new breastfeeding mothers. Number one, you need to use only water to clean the breast. So avoid soaps, avoid lotions, avoid oil, avoid petroleum jelly as this can interfere with the natural lubrication and can cause sore nipples. Also lubricate the nipples with express milk after feeding. This will help prevent nipple tenderness. Inform about the milk volume changes. So the nurse will be able to tell the mother that milk typically increases between day 2 to day 5 postpartum and may come with the breast changes, including even size and a slight temperature rise. Also, the mother should be able to manage engorgement proactively. So in this case, they need to use warm compresses, they need to do massage, they need to do reverse pressure softening. You soften the areola for easy latch. And also they need to have warm showers or do milk expression before feeding, cold compresses after or before feedings. All this can help reduce swelling. They could also benefit. They should also be aware of the benefit of warm techniques. Warm techniques normally help dilate milk ducts, promote milk letdown, and soften nipples for easier latch. They also need to soothe the sore or cracked nipples, so they can use warm moist compresses like tea bags, express milk, or lanolin cream to ease discomfort and promote healing. Also, they also need to be able to recognize and report plugged ducts. So they usually appear as small, plugged ducts appear as small, tender, palpable breast lumps. They also need to resolve and prevent plugged ducts. So apply warm compresses, massage while feeding, vary feeding positions, and avoid tight clothing. Complication of breastfeeding can we could have a number like breast engorgement. This is where this breast is painful. It's painful swelling of the breast, and this is due to increased blood flow and milk accumulation, especially in the first days of postpartum, between the second and fifth day, right? So the breast, the signs and symptoms include breast pain, tightness, warmth, tenderness, and sometimes low-grade fever. So management is by frequent feeding, warm compresses before feeding, cold compresses afterward, reverse pressure softening, and gentle milk expression. The other complication is mastitis. So mastitis needs continued feeding and sometimes even antibiotics like amoxicillin. Mastitis is the inflammation of the breast tissue, often caused by a blocked duct or bacterial infection. Patients have localized breast pain, redness, swelling, fever, chills, and fatigue. You manage it by continued breastfeeding. We also have fungal infections or thrush. This is caused by Candida albicans infections affecting the mother's nipples and even the infant's mouth. So the infant will have white patches on the tongue or cheeks or fussiness or refusal to feed. The mother will present with itchy, burning nipples, deep shooting, deep shooting breast pain during or after the feeds. You can treat, remember you have to treat both the mom and the baby using nystatin suspension for the infant or the cream for the mother. So for the mom, you apply thinly on the nipples after each feed for 7 to 14 days. Then you gently wipe off excess before the next feed if needed. For the baby, you give nystatin oral suspension. So you give one meal orally 4 times daily after feeding for 7 to 14 days. Then you need to apply using a dropper or a cotton swab inside the baby's mouth. Nipple pain. So nipple pain, you always think of nalonin, milk, and rest. So we'll have cracking and bleeding soreness often due to poor latch. So correct positioning, that is the kind of management. And remember the signs of poor latch include nipple pain is one of them. Could also have a clicking or a snacking sound during feeding. The baby's cheek appearing indented. Notice the poor latch on my far right. Nipples turn inwards, mouth around the nipple, chin not touching the breast. Remember, we need to see the chin touching the breast, mouth wide open, and the lips turned outward, not inward. We also have the plugged or blocked ducts, where the patient presents with localized tender breast lump, sometimes redness or warmth. You manage by frequent feeds, massage, warm compresses, varied feeding positions, and you avoid tight clothing. So for plug ducts, you massage, you do warm compresses, and you vary feeding positions. Infant complications from inadequate milk transfer could result into dehydration, poor weight gain, so dehydration where the baby presents with dry mouth, fewer weight diapers. Poor weight gain, falling growth percentiles. Remember, the weight is supposed to double, the birth weight is supposed to double at 6 months and triple at 12 months. The baby can also have prolonged jaundice, that's yellowing of the skin and eyes as a sign of inadequate milk transfer. So what you're supposed to do, you assess the latch, ensure that it is okay, mouth wide open, lips turned outward, right, and the chin touching the breast. Okay? Signs of poor milk transfer: dry mouth, poor weight gain, prolonged jaundice. A good latch, we have wide mouth with chin touching the breast and rhythmic sucking. All right? So the baby's mouth should be wide open, like a big yarn. Baby's chin should touch the breast with the nose close but free to breathe. Notice more areola is visible above the baby's top lip than below. Okay. Baby's lips should be flung outward like little fish lips, not tucked in. Okay. No clicking or smacking sounds, just quiet sucking and swallowing. Baby will have a steady suck swallow breath rhythm with soft jaw movement and visible swallowing. Let's close this discussion by looking at the advantages of breastfeeding, and we're going to use the mnemonic breastfeeding. So B for bonding. Breastfeeding normally promotes strong emotional connection between the mother and oxytocin. R for reducing risks. Breastfeeding decreases breastfeeding risk of infections, allergy, obesity, and chronic conditions like diabetes. E, cost effective as it eliminates the need for the formula or feeding bottles. Can someone tell us the average cost for a formula, breastfeeding formula? Yes, F for provides, this one provides antibodies that boost the baby's immunity. S for environmentally friendly with no packaging, processing. I just asked about the cost for formula and you're not able to tell me. Remember for none, the one that we commonly use, it's approximately 1,800 to 1,900, 600 per 400 teen, right? And most infant formulas. So if you look at in terms of cost breakdown, like monthly estimates, an average infant is going to use 2 to 3 teens of the formula depending on the feeding volume. So the estimated cost is about between 3,000 to 6,000, right? So the annual estimate that could be between 36 to 72,000. I think when women are asked what do you bring on the table, you could talk of 72,000 per annum. Does that make sense? Yeah, it does. It does, by the way. Yes. Okay. T for temperature regulation. So we have skin to skin contact, which is going to help the baby's body temperature to be within the normal equilibrium. F for fewer illness. So breastfed babies have lower incidence of diarrhea, respiratory infections, and ear infections. Exclusive nutrition offers complete, perfectly balanced nutrition for baby's growth and development. I think this one we showed in the first two slides. Emotional benefits. So we have the release of oxytocin in the mother, which is going to reduce stress and promote relaxation. Loving hormone. Did we say that? Yes. Breast milk is easily digestible. This reduces the chances of constipation or colic in babies. I is for the intelligence. So intelligence has been associated with, or breastfeeding has been associated with high IQ scores and cognitive development in children. So that is also another advantage. And lastly, we have nutritional benefits where it contains essential vitamins, minerals, enzymes, which are tailored to the baby's needs. Lastly, we have G. So breastfeeding supports health, physical and mental development during the baby's crucial growth phases. So ladies and gents, I think we have come to the end of this presentation. We were supposed to review the breastfeeding positions. So I hope you have them. So let's continue interacting with our new mothers as we teach them all these breastfeeding techniques. Let's all be champions of breastfeeding in both the hospitals and communities. So guys, remember to like our videos, comment, and share. And don't forget to subscribe so that you can be able to get videos of same kind. Thank you so much and see you again.